My name is Dr. Elizabeth Rutha. I am a clinical psychologist and I am the director of behavioral health operations for Advocate Healthcare. So I oversee behavioral health in all of the Illinois hospitals that are part of Advocate Healthcare. The closest
Huh?
to you, all of you are located in or around Glenview, I'm assuming. So the closest Advocate hospital to you would be Lutheran General Hospital. If you're further north in the suburbs, maybe you're familiar with Condell Medical Center. So those are the two that I work most closely with. But we have several hospitals across the
Yeah.
Chicago metropolitan area. So that being said, I am a psychologist who has been in practice for over 25 years. I've worked in outpatient realms, in partial hospitalization. I currently oversee the behavioral health crisis teams in the emergency department. So I am talking with all of you through a lens of many different modalities of mental health treatment that we have. I'm glad to be doing this presentation today because the fundamentals of mental health are one of the core components of functioning as a human being. If you don't have mental health, you are not going to be living your best life, certainly, and you are not going to have a very high quality of life. So today we're going through some basics that many of you are already familiar with, but I think it's always good to underscore. And please feel free to ask questions as I go through this. So we have about 25 minutes here today. So we will cover some of the fundamentals. Can everybody see this presentation?
Yes, I can.
Okay, excellent. So let's move to our first slide here. So in terms of just sort of the core components of mental health, you start with emotional well-being. So this involves understanding and expressing your emotions appropriately for a sense of mental balance. There's psychological well-being. This is a very important one because it includes your self-perception, your resilience during times of stress, your coping skills, and having a sense of purpose in life, which obviously is what keeps us motivated and keeps us moving as we move through different phases in our lives. There's social well-being, which is focusing on building healthy relationships and fostering a sense of belonging and support networks in our lives.
Mhm.
And holistic mental health, that's an important concept to think through because mental health and physical health impact each other profoundly. They're one and the same in many ways. So understanding how to care for your body and for your mind leads to improved outcomes across all realms of your life. And the two are inextricable, your physical health and your mental health. So when you care for your body, your mind tends to do better. And if you care for your mind and your psychological well-being, your body will typically function better. So those are some important tenets to keep in mind.
Doctor, have you ever read Man's Search for Meaning with Viktor Frankl?
Absolutely.
Yeah,
Absolutely. An
yeah,
amazing book, and I would recommend it to everybody
yeah. I
from an
read it. I try
existential
to read it once a
standpoint.
year.
No, good for you. I mean, from an existential standpoint, in terms of getting a sense of creating a sense of meaning in your life, it's a wonderful book, Man's Search for Meaning. I would recommend it. So moving into some common mental health conditions, I think this is important to keep in mind because it really highlights just how prevalent these mental health issues may be. So first, we have our group of anxiety disorders. I started with anxiety disorders because it is the most prevalent and common mental health disorder in our society. I have in bold here that an estimated 19.1% of US adults have diagnosed symptoms in any given year. So at any given time, almost one in five of us have a diagnosable anxiety disorder, and 31% will experience some type of anxiety disorder, diagnosable anxiety disorder, within their lifetime. So anxiety disorders are exactly what they sound like. They're characterized by excessive worry, restlessness, oftentimes physical symptoms such as muscle tension, rapid heartbeat. So people with anxiety disorders do sometimes end up in the emergency room with these extreme symptoms that feel like a heart attack, maybe feeling like they can't breathe. In reality, this is an anxiety disorder. I think all of us can relate on some level to what this feels like, even if you don't have a diagnosable anxiety disorder. Certainly, all of us have experienced it, maybe stressful times in our life, excessive worrying, difficulty shutting down our brains to relax, that sense of being on edge, restlessness. So, this is what an anxiety disorder is. We also have mood disorders. Those are conditions which create persistent disruption in a person's emotional stability, including major depressive disorder. Major depressive disorder, I think most of us are familiar with. It's a persistent feeling of maybe sadness, hopelessness, loss of interest in daily activities that would typically be interesting to you, sense of low energy. Whereas bipolar disorder, in contrast, is characterized by cycles of mania and depression. So that's where you have those extremes in your mood. Extreme
Mm.
highs, that mania, that feeling of having tremendous energy, feeling it like you can do anything, suddenly contrasted with a sudden drop in energy levels, sudden feelings of hopelessness, sadness. So that's bipolar disorder. And it creates a lot of, you can imagine, difficulty functioning because there are such extreme mood swings. Um, Additionally, we have persistent depressive disorder. In persistent depressive disorder, these symptoms aren't quite as severe. They're lower grade symptoms, but they last much longer. So this may be the type of person who feels down, feels unmotivated for very long periods of time, sometimes several years on end, without ever quite having the severity of major depressive disorder. Then you also have seasonal affective disorder. I think all of us who live in this climate can probably relate to some aspect of seasonal affective disorder. That's characterized by people who experience depression during the wintertime months where we have less sunlight. So that is very much a biologically based condition where people are reacting to having less sunlight and therefore lower mood, lower motivation. So it is seasonally affected, and people do often travel to warmer, sunnier climates to try to manage this condition. Also, that is manageable via light therapy because it is that exposure to light that is important with seasonal affective disorder. So those are your mood disorders as a quick overview. We also have post-traumatic stress disorder, PTSD. So that develops, of course, after exposure to a traumatic event. So that may be the type of event where one may feel like they or a loved one are about to lose their lives or about to die. Um, or more chronic types of stressors like having domestic violence in the family, living in an area that is so unstable that there are, frequent life-altering types of circumstances, like being maybe victims of crimes, things like that. Post-traumatic stress disorder includes flashbacks, hyperarousal, so feeling always on edge, feeling always like you have to be looking around to ensure your safety because you are anxious that some type of life-altering event is going to happen again. And also emotional numbness, because people with PTSD are often so focused on their physical safety or the physical safety of those around them that they develop a sort of emotional wall to be able to protect themselves. And therefore, it's difficult for them to experience pleasure, pain in the way other people do because they're constantly guarding themselves and protecting themselves. Then you have a group of more severe mental health disorders, which are the psychotic disorders. So, this group of illnesses is characterized by a disconnection from reality. The symptoms here would include hallucinations, delusions, disorganized thinking, so difficulty even being logical, using proper judgment, because the sense of reality is so distorted in this type of disorder. So, this is far less common, and these do require professional treatment, psychiatric intervention, usually medication to treat them. Finally, you have your group of personality disorders. Your personality disorders are characterized by rigid thinking, inflexible thinking patterns, feelings and behavioral types of behaviors that are long term. They impair daily functioning. They're often lifelong. So, personality disorder is different than these other disorders that I've just described because it is a lifelong pattern. It is not something that is typically treated via medication. It really does require long-term therapy to try to change these rigid patterns of behavior. So those are your overall groups, your broad groups of different mental health types of disorders that you may encounter. With regard to some warning signs that I would recommend that you look out for either in yourselves or others that you may deal with that are early indicators of some type of mental health problems. Um, One would be early sort of indicators of withdrawal, irritability, mood shifts that often signal the beginning of mental health problems. So all of us have mood shifts occasionally. That's nothing unusual. That's nothing to be concerned about. But if you're seeing mood shifts that are longer lasting and different than what the person's usual presentation is, that's often a sign. Ongoing irritability, difficulty focusing, maybe withdrawal from situations that would usually be interesting or pleasurable to a person. Those are your early behavioral indicators that something may be different and something may require attention. There's also some physical and cognitive signs, changes in sleep, appetite, ability to concentrate, and even hygiene. A person who usually takes good care of themselves and suddenly is disheveled, is not taking care of themselves, does not seem like they're maybe paying attention to basic hygiene. Those are some good indicators that something needs to be paid attention to and focused on, and some type of professional intervention may be necessary. Um, your more serious warning signals, things like expressions of hopelessness and helplessness. Somebody saying, I feel like I can't go on anymore. I feel like there's no hope for the future. I feel like things will never get better. I have nothing to look forward to. Or certainly statements of wanting to harm oneself, wanting to hurt oneself and their lives, things like that. Those require immediate support and professional intervention because those are very serious warning signs that somebody may be at risk of harming themselves in some way. Um, the community plays a big role here. So, family, friends, workplaces, schools, other community organizations, places of spiritual worship, any of those can be a support system. And it's great that we're doing this presentation today because, of course, Rotary Club is a community organization where if you're educated on these warning signs, you can help others if you see these in others, and certainly if you see them in yourself. So it's important to make certain that these that this understanding is well embedded in communities so that early intervention can happen before symptoms get serious and people have more serious consequences. So those are some basic things to look for. With regard to community contributing factors and barriers that can cause problems, in terms of biological, environmental, and lifestyle influences on mental health, biological influences are, of course, your genetics, your brain chemistry, hormonal changes. Those can all impact emotional stability. We know that some people do have genetic predispositions. Sometimes mental illness can run in families. That's only a small piece of the puzzle. That does not mean that if somebody's parents had a mental illness, the children will necessarily have mental illness. They may have a genetic predisposition. That doesn't mean that they will end up having mental health problems. These other elements are also very important, but it is something to be aware of. Certainly, even hormonal factors or illnesses may create a predisposition. I think we all became aware of this during COVID, for example. During COVID, you may be aware that a lot of people that had COVID developed something called post-COVID syndrome or long COVID. People who had long COVID had a much, much higher rate of depression than the general population. So even something like a virus or some type of attack on the body could create a predisposition to other types of mental illnesses. Um, there, of course, are environmental and social factors. These play just as big of an influence on mental health issues as biological influences. So, things like chronic stress in the family, a difficult family environment where there's often conflict, maybe there's something like substance use, alcoholism in the family, other unsafe conditions in the family, certainly any type of trauma, those will create a predisposition, a much stronger predisposition to other mental health types of symptoms. Things that we now label childhood adverse events. So any type of chronic trauma in the family, and as I said, an unsafe environment in the family for a child creates a much higher likelihood later on in life to have mental health issues. So those are things to be aware of. If you know of people who have those in their families, they may be more vulnerable. Lifestyle and relationship factors, as I already mentioned, things like sleep, exercise, nutrition that play a big part in physical health, they also play a huge part in mental health. So if somebody isn't taking very good care of their body physically, their likelihood to develop mental health symptoms is much higher. Challenges with social support. If somebody is isolated, lonely, or has unhealthy relationships, that's going to impact emotional well-being as well and resilience. So it's again creates vulnerability. Cultural and economic impacts. Of course, if somebody is living in a situation where there is economic hardship, there's a lack of safety with regard to basic determinants of health, like having safe housing, having regular access to food, things like that. Mental health will be compromised, as well as living in a cultural situation where people maybe don't value mental health or don't understand mental health is going to create some challenges. So those are things to be aware of too in terms of vulnerabilities. Of course, we have the impact of stigma. We know that mental health is still stigmatized in our society. Many people don't, to this day, understand the importance of mental health. So there are lots of cultures and lots of families in which it's discouraged to talk about mental health issues. Maybe it's viewed as a sign of weakness. Maybe you hear in certain cultural types of contexts that talking about anything mental health related is viewed as a sign of weakness or that you're crazy. There's also a lot of misconceptions, like mental health or mental illnesses are something that are rare or untreatable, that it's something that, few people suffer with and you can't get any help for it. As I already mentioned, they're actually quite common. 1 in 5 people at any given moment are experiencing some type of mental health issue. So that's actually very much untrue. They're also highly treatable. So those types of misconceptions are still common in many families and many cultures. So we do want to break down those types of misconceptions. Also, we have the issue of limited access and high costs of receiving mental health treatment in many places. We now have something called mental health parity, where medical insurance does need to cover mental health treatment for people who need it, but at the same time, that's often more expensive and still more difficult to get. Many populations that are living maybe in more rural areas don't have access as easily as others do. So there still are cultural inequities and structural inequities in terms of being able to access mental health treatment. So, do know that. So the type of thing that we're doing right now, having community education opportunities, having supportive conversations with people, and having policies that are built into workplaces, into schools, into religious institutions, though those do help to provide early intervention and to just create a dialogue where people can talk about mental health issues and feel like they're supported and feel like there's a way to get some sort of access and hope for whatever they're dealing with. So, in terms of supporting people through mental health challenges, again, we start with conversations like this, having awareness and having empathy. So, if you're aware of the types of things to look for, people talking about feeling maybe vulnerable, feeling not like themselves, maybe feeling like they can't focus, like they've had a period of feeling really low and down, feeling like they're worrying excessively, or again, talking about more serious issues like wanting to harm themselves or feeling like there's no hope, begin with empathy. Listen openly without judgment, create a safe space for people to talk to you about it, and talk openly about seeking professional health. In terms of breaking that stigma of people being afraid to access mental health treatment, one of the easiest things to do is just to talk openly about the fact that there's lots of resources available. Most insurances cover this for people, so it's not difficult to access this care. And even if people don't have good insurance, there's community agencies or even text lines, phone lines that they can call to receive some type of help. So it doesn't even require financial resources to get started if that's what they need. Um, and again, if you do, I've said this many times already, but I can't emphasize it enough. If you do hear somebody talking about extreme types of symptoms like wanting to harm themselves, there are hotlines, emergency hotlines that can be accessed immediately 24/7. And I'll give you those resources before we finish. The community support piece is really important in terms of encouraging peer groups and at organizational and institutional levels to be able to foster connections, give people EAP resources at their jobs if they're currently working, resources at schools for kids who aren't at school, and again, community organizations such as this one or religiously affiliated organizations, whatever a person is connected with, to be able to be more aware and to give people an empathetic place and a safe place to talk about these vulnerabilities because people do feel very vulnerable still when it comes to mental health issues in a way that
Yeah.
maybe they feel less vulnerable about when they're dealing with other health care related concerns.
Doctor,
Yes.
are you familiar with NAMI?
Absolutely. NAMI is an excellent resource. Thank you for bringing it up. That's the National Alliance for the Mentally Ill.
Yeah.
Um,
I
and it
was on
is,
a board up here in, I'm up in Wisconsin, Warworth County. We had a group there, and the executives up in Madison decided to close it down for some reason.
oh, what a
But
shame. What a
yeah,
shame to hear that.
yeah, there were a lot of other, counties that do have it, but I don't know. I'm not sure why they closed it down in our area. But it was very helpful. I sat on the board of this, and it opened my eyes to a whole new world of people who were suffering from mental illness. And
Yeah.
yeah, yeah,
Absolutely. No, I'm glad to hear that you have awareness of that group. It's an amazing resource, not just for the people who are
yeah,
struggling, but for their families too. They have
yeah,
great family support groups
yes,
too. The nice thing is there's now so many virtual resources available for NAMI where, as you mentioned, if it doesn't exist in a certain area because the group isn't running in a certain geographic area, people can get national resources now
yeah,
via NAMI.
yeah,
So they can attend virtual groups even if they need a support group, for example, whether again it's the person who's struggling with mental illness themselves or a family member or loved one of somebody who's struggling. So it's a great resource. So again, thank you for mentioning it. It's so we partner with NAMI frequently on many
oh,
events,
okay. Well,
particularly in the last month.
they're
I
having,
don't know if you're aware, but May is Mental Health Awareness Month. So
yes, yes,
NAMI, of course, is a big area of focus, is very active during that time. So we do partner for on a lot of different activities. There's a walk that they do every year
right.
to raise funds. So we partner with them on that as well. So yeah, so thanks for mentioning it.
Yeah, and
Um,
my only concern is this new technology, AI. There have been a lot of trade-offs in all the technology. Some young people have committed suicide because they were listening to the advice of a machine, which wasn't very helpful.
Yeah,
Uh,
you
you
bring
could,
up an amazing point, and it's something that I'm going to touch on in a minute in terms of making certain that when somebody does reach out for help, they're reaching out for help to a licensed mental health professional. Because
right,
I mean, that is, although there are advantages to having some of these virtual resources. They're wonderful in the sense that, the access is easy. If somebody is not familiar with the resource and doesn't have a lot of financial means, it's great to have it so easily available. But the downside is you can get some really inaccurate information, sometimes dangerous information. So it's important to seek a licensed mental
yeah,
health professional. So again, just a few things to be aware of as we're discussing self-care. Self-care is such an important part of mental health. Some people still operate under the conception that caring that you need to care for everybody else before you care for yourself. That's actually not the best strategy. If you don't take care of yourself, you can't take care of others very well either. You can't take care of your family that needs you. You can't take care of your colleagues at work or whoever else it is that is important to you in your life. So care for yourself first so that you can care appropriately for others. And to do that, you do need to prioritize rest and physical activity. You do need to be aware of nutrition. It's, again, taking care of your body and taking care of your mind are very closely tied to one another. Managing stress by using activities like mindfulness, journaling, and social connection to reduce stress and foster strong emotional support networks is important. Boundaries, setting healthy boundaries, whether it's interpersonally in your personal life or in work relationships, it helps to prevent burnout and to foster healthy types of relationships. And having creative outlets, hobbies such as art, music, physical activity, whatever your hobby is, helps to rejuvenate you, to give you a sense of meaning, a sense of purpose, and to relax you in ways that promote resilience and can promote social engagement as well. So those are so important. With regard to professional treatment options, some of the different options that we have are therapy and counseling modalities. So, CBT, DBT, trauma-focused therapies, those are just a few examples of evidence-based treatments that we use. But once again, seeking the help of a licensed mental health professional is what is most important. Because again, some of these virtual platforms, you don't know who you're talking to. It's easy access, it's great. It may feel good to have a source to connect with, but you're not necessarily certain who it is you're talking to or whether they're a viable resource or a trustworthy resource. And seeking out a licensed mental health professional doesn't always require excellent medical insurance. If you have it, that's great, but some people don't. And there's still ways that you can get connected with a licensed mental health professional. I'll tell you what those are in a moment. Um, Other than therapy, there's another option, which is medication. Medication is prescribed by psychiatrists and often complements psychotherapy. There's many classes of psychotropic medications. The most common are antidepressants and anti-anxiety medications. Those are highly effective and usually work within a few weeks, so they can really alleviate any mental health symptoms. Of course, they often need to be combined with therapy for talk therapy, that is, for maximum effectiveness, but they are on their own quite effective as well. I've already mentioned employee assistance programs. That's something that is offered via the workplace. So if somebody is working for an organization and they're experiencing these symptoms, I encourage them to ask their employer about EAP resources. There's also crisis intervention resources. So crisis hotlines. Now there's a lot of support via text, so that may feel more comfortable for a lot of people. If they don't feel comfortable reaching out verbally, it may be more accessible to them to use a text support system. There's mobile crisis teams now that can be deployed in communities to actually go out to the home of a person for a rapid response for people who are in immediate distress. And as I've already mentioned, community centers, school counselors, and telehealth can expand mental health services to underserved areas. If somebody doesn't have access to their own licensed mental health professional that they can access rapidly themselves. As I mentioned, it's really important to have immediate resources and free resources that are available to everybody. The 988 crisis hotline, I'm not sure if everybody is familiar with it, if you've heard about it, but if you haven't heard about it, the National Suicide Hotline, it's called the National Suicide and Crisis Lifeline. It's a free 24/7 resource that anybody can access by dialing 988. So that number is really important. If you know of somebody that's dealing with a mental health crisis currently, if somebody is talking about feeling hopeless and helpless, or helpless, 988 is the number to call. 24/7. These are trained mental health counselors that can provide you with immediate resources by deploying these crisis resources, mobile crisis resources in your neighborhood. Or if an immediate resource isn't needed, if it's not somebody that is in immediate distress, they can link you to some type of mental health resource, even if it's somebody that doesn't have insurance, even if it's somebody that doesn't have the financial resources to access it. So it's an amazing resource. And if somebody can't remember 988, I think most people can remember 911. So you can always just dial 911 if somebody is in crisis, and you can say somebody's going through a mental health crisis. If it's somebody who is immediately at risk of harming themselves, an ambulance will be deployed. If it's not as immediate, they will be transferred to the 988 crisis number, and that number can provide resources, mental health resources. So those are some immediate options that are free that anybody can use. If somebody does have resources and does have medical insurance and it isn't something that is acute, they can always access the resources through their medical insurance. Every medical insurance now has access to some type of mental health clinicians, and those would be licensed clinicians that one can set up regular therapy with. So that is not an immediate acute resource, that is more a long-term resource that somebody can access. So that's an overview of some of the different options that are available to people that are dealing with mental health issues. I realize that I've sort of maximized our time, but does anybody have questions or comments for me?
Yeah, it's this happened about 10, 15 years ago. The Rotary was into mental health. Some suburb that there was had a connection to the rail line, and they put up a big notice about the suicide line here, and the community actually was against having that sign put up because they thought it encouraged people to commit suicide, which I thought was kind of ironic. Here they're trying to pass along, this was before the 988 number, and they said, you're just advertising suicide with your big banner on the railroad station. And I just shook my head in saying that people react so different adversely about the mentioning of suicide. And I think from my training, I found that if it's all right to mention, are you feeling like you want to do suicide, because that person then it sort of wakes the person up, and it makes them think, or her makes them think about, why am I thinking about that? It's not something you shouldn't not mention. That's the training I've gotten from the sessions I've gone to in NAMI.
Absolutely. You're very wise, and what you're saying is so important. And it speaks to the stigma that people still experience around mental health issues, right? The fact that a community reacted so strongly against the mention of suicide. Well, as we've just talked about today, the more that you can talk with people about it openly and allow people to understand that this is something that happens in life and we need to talk about it, that it's safe to talk about it. It's safe to seek out resources, whether it's through your friends and family or via professional resources, then the more likely people are to get support when they need it. And that's going to help to prevent some of these crises from occurring. So
Yeah,
it is so important to offer people a safe place to talk about it.
yeah.
So I'm
Well,
glad to hear that you've received that training.
yeah, it's a bubble. We all live in our bubbles, and you go outside and you find out that there's other tragedies out there, or strange things going on. So, yeah, I drive a lady up to her psychiatrist twice a month to help her out since the group disbanded. And yeah, and I think we all have some kind of mental illness, not as severe as you see on the news, but something, that my own thing, I like to procrastinate a lot. I don't, I used to wait until the last second, and then I got somebody gave me the philosophy: if there's an elephant in the room, don't try to swallow it all at once. A bite at a time, you can handle it. And so that kind of reduced my stress quite a bit. So,
Yeah, I think that's a final note. I do realize that we're out of time, but it's what you mentioned is very important. Is we always say mental health is a continuum, meaning
yeah,
yes, you sometimes hear about the very severe mental health issues, but all of us have some element. As you stated, we've all experienced anxiety, I'm sure. We've all experienced feeling down, feeling some, low grade form of depression. We can all relate to that. Some people just experience it on a more severe level. Any of us may at any given time in our life, which is why it is so important to talk with people openly about it to get the support, and you'll get through it because it is very treatable. If you get the support early, even if you don't get it early, it's treatable. But if you get it early, then it's even more treatable, and you can probably treat it more quickly. So it is a continuum. There's nothing quote unquote crazy about mental illness. We've all had some of these symptoms in our lifetimes, and the sooner you
yeah.
get help for it, the better off you'll be. So do seek out those resources.
Yeah, yeah, that's why I join a lot of groups, because I live by myself in my condo and the walls sort of close in on me. So I join the Toastmaster groups. I'm the president of our homeowner association here. I do Rotary, and I'm going to be grilling brats for American Legion guys down in McHenry Veterans Park. So I'm forever keeping busy, in addition to trying to learn calculus on the machine here. But you can expose all these problems going on the internet. It gets depressing at times. I have to turn on the comedy routines
Well,
just to
you
get
have the
away.
right approach. The way to counteract it is to get involved in your community, help others, engage with others, find something that you find enjoyable, be
Yeah.
involved in it. That's the way to counteract it and to have a healthy sense of well-being. So, on that note, I do realize we're out of time. So why don't we finish up for today? But it's been a pleasure. And if you ever have any other questions, please feel free to request more presentations on mental health, and we'll be happy to do it. So
Are
have a
you
great
out
day,
of
everybody. It was nice to meet you. Take care.
okay? Bye bye.
Bye.